So, hello everyone. I would like to welcome all of our listener and watcher at our first episode of Veterinary Profession Podcast. Our today guest will be a president of the Union of European Veterinary Hygienists, Jason Aldiss. Hi, Jason.
Hello, Zuzanna. How are you doing?
I'm doing great, thank you, and I hope that you are also doing great. I prepared
Yes.
for you a few questions because our members would like to know more about your veterinary career.
Excellent.
Okay, so we will start with just a normal question from students. So, why did you choose to study veterinary medicine?
It's a slightly different pathway. I was, I actually wanted to do law, to be honest, but I had a strong inclination with farm animals, and I had obviously as a child lots of animals, and so I had a lot of strong interest. And I worked in a small animal clinic for 5, 6 years every weekend during school, high school, and it gave me a very good understanding of the profession before I went into vet school.
I think that's really cool because I don't think that a lot of students have the chance before going to university to see how work of veterinarian looks. So it's very good. Um, yeah, so I wanted to ask it, was it always your passion to pursue this field in veterinary medicine?
In the public health field,
Yes.
yes. So when I went into veterinary school, I knew full well that um, I wanted to specialize in public health. And I knew I needed to do a couple of years in practice and then specialize in public health. So that was very much my career ambition, yes.
Okay, but how did you get into your field of veterinary medicine?
Um, I sort of fell into it really. I mean, it was my desire to move into this field, and an advertisement came up. I was in New Zealand. I'm a New Zealand graduate, and I was in New Zealand, and an advertisement for my old company was put up on the notice board at the university, and I applied. That was for an official veterinarian to work in a slaughterhouse. So that was my first intro. But before then, I'd been doing a lot of work with the local slaughterhouses and my cattle clients and pig clients, looking at pathologies and what I could do to improve the herd and flock health of animals that were under my care.
Okay, okay, that's great. So, do you think that health topic is covered enough in the general veterinary curriculum worldwide, or maybe in UK?
I've always been slightly critical of how veterinary public health is taught. It's changing, and a lot of the newer universities have a different approach to teaching veterinary public health. I take the view that veterinary public health is actually the umbrella that covers all of the various different strands of clinical of veterinary medicine. Uh, Veterinary public health is not just meat inspection, it's very much all interactions between animals and humans. So therefore, it's farm animal practice, small animal practice, and I think veterinary public health should be taught at day one so that it feeds as a foundation through to the whole veterinary program.
I totally agree with you because I think that for most of the students, when we start our journey with veterinary medicine, we all are thinking that public health is only about the slaughterhouse. We are totally forgetting about the concept of one health, about the infection disease, about the zoonotic disease. So I totally agree with you. And moving next. How do you think, how can students gain the most experience in your fields in public health?
I always say to students that approach me with this question that everyone must do a couple of years in clinical practice. They must see the interactions that vets have with their clients' animals. They need to experience that, whether it's a small animal, ideally mixed animals, so that you've got a range of different experiences that you then take into your journey into veterinary public health. Um, so a number of my colleagues have done a little bit of meat inspection. They've gone and done some laboratory work. they've either specialised or done a diploma in veterinary public health, or they've done some One Health work with maybe the state veterinary office in their country, or they moved down a different pathway, maybe working with industry, the various different industries, so pharmacology or the meat industry or the food sector. So it's about picking up and growing your portfolio as you move through your career. You don't suddenly become a public health vet overnight. You grow into one.
Yeah. Um, right now, you are the great mentor for students like me. But I wanted to ask, did you have a mentor to guide you on your path? If yes, who was it and how he or she did guide you and help you?
There was an old Yugoslavian vet, so we're going back a long time now, called Bill Bestel, in the slaughterhouse in where I did my undergraduate training, and he was a fantastic mentor and a fantastic teacher. He enthused me, he challenged me, and he really did guide me and set me up on my pathway.
Okay, okay, that's great.
He rode for Yugoslavia for the Olympics in the 60s, I think.
Okay, wow, that's quite a time ago.
Yeah.
Yeah. And moving back to the times, I wanted to ask, what should you say to yourself if you could go back in the time and give yourself an advice while you were a vet student? Maybe would you have done something differently?
It's a good question. I probably didn't move around enough, so I
Hmm.
remained in the same company for too long. I was the managing director of that for 25 years, and so it gave me an opportunity to do a range of different activities from that position. But I should have probably moved out and done other things, um, just to keep the brain active.
Yeah, I mean, I can agree with you. You already know that I love to traveling and meet other people in other countries and to see how work, but also an education of in veterinary field looks. So I totally agree that moving around and trying new things is very, very important in our career. Um, Also, I wanted to ask, where do you see difficulties for vet students that want to follow your career path?
Um, Well, the difficulties really are just a lack of imagination on behalf of an individual that wants to do something. So I don't perceive real difficulties. Veterinary public health gives you the opportunity to do everything and to see and act within all sorts of areas of activity. So it really is only limited by your imagination. So if any difficulties is it's at the beginning of your career when you come out, you've got debts, you need to the realities of life, you need to settle in, you've just come out of university, it's a difficult time those few years, but you need to just focus on your pathway and say, look, I'll do a couple of years in clinical practice, I'll then look to expand out. So yeah, those first couple of years are a challenge, but they're also fun.
Okay, we already talked a little bit about the veterinary curriculum, but I wanted to ask that do you feel that your time you spent at your university prepared you good enough for veterinary work in public health?
Simple answer, no. When I was taught by a wonderful man, he was a Danish professor, but we were taught meat hygiene, meat inspection. We weren't taught public health, and so I developed an interest and an understanding of veterinary public health through my various different activities, through my professional association, through networking with my colleagues, through working with Federation of Vets of Europe, so I developed myself in that field rather than coming out with an adequate level of training.
Okay, I can understand that. I wanted to ask also, how do you see the future of veterinary medicine, especially public health? First, I wanted to ask about your country, but I know that you're a European specialist, so maybe how do you see the future of public health in Europe in general?
Well, I think over the last few years, we've seen veterinary public health absolutely come to the fore in terms of a specialism within the profession, particularly when we look at subjects such as One Health that you mentioned before, zoonotic disease, the spread of as the environment changes, the spread of vector-borne disease. We're seeing it sweep across Europe, for example. We've got antimicrobial resistance as a real issue within the human population. And all of this is relevant to veterinary public health. Also subjects such as food security, with the war going on in Ukraine, we're seeing that the loss or the reduction in grain, which has put the prices up, which is impacting on farming, which is impacting on food security. All of these different issues impact on veterinary public health. So there's a lot of different areas of interaction there that we that need to be addressed. And the role of the veterinarian is key within all of that. So if you talk about sustainability, the agri-food sector needs to move into a more sustainable mode or model, and the vet can really assist and support farmers and the agri-food sector in that move.
Yeah, I'm really happy that you said these things because I know that everything is going forward, that we are moving forward and we are experiencing new things, but also we are changing things to better, I hope, in the future. And especially that One Health topic is very important for me because I would like to focus on this in my future career. Maybe not as you, but I would like to focus it in my scientific way. Now, I just wanted to ask for a few questions more connected to your career, not maybe connected to veterinary education as this before. So, first of all, what are soft skills that are needed in your profession?
Soft skills. I think one of the areas that we don't necessarily excel in as a profession is communication and empathy. When we connect, every animal has an owner, and to get to that animal, you need to engage with that owner. And if you can't communicate effectively with the owner, you may not necessarily get the opportunity to work on that animal. So communication skills really are absolutely critical in every field of veterinary medicine, but particularly in veterinary public health. So that would be the key soft skill, but also the ability to, as I said, empathize, but that's all part of communication, but also the ability to think laterally. I think sometimes we come out of university and we can be quite focused. And I think we need to open up and look at the world through different pairs of eyes. We have horrible statistics of suicide rates in amongst our profession. And I do think some of it comes from a frustration of not being able to see an alternative and feeling trapped within a particular pathway.
Okay. I know that your work is a little bit different than the regular clinical professional work, and I wanted to ask how are looking this difference in work culture from your profession from a regular clinical profession.
Um, well, my role is very much advisory. I use my clinical skills in a range of different areas, but whether that's development of policy, whether that's development of disease control programs, whether that's consultancy work in a slaughterhouse, for example, whether that's politics with a big P or a small p, in terms of dealing with the local politics or dealing with national politics. So it's very much, it's but again, all of those areas will impact on a clinical vet too. So I think our areas of skill set is crosses over a lot.
A lot of our members are wondering how to talk about politics. And I wanted to ask that did you face any situation to comment politically? And if so, how would you manage to do it more neutrally?
Well, there's different answers to your question, whether that's a scientific or um, uh, technical political question, or whether it's a heartfelt um, passion directed question or political situation. So I do comment and have commented it politically over many, many years. I've been involved in politics for some 25 years. Um, I, I comment both from a veterinary political point of view on specific issues such as uh, very highly charged and emotive issues such as um, ritual slaughter. That's a particular area that people feel very strongly about. And the only thing that I would say is if you're going to comment on anything, make sure that you are informed and that you're educated and that you know what you're talking about in terms of the facts, and try and keep as much of the emotion out as possible, unless you're talking about Brexit. And then I got very emotional because I fought against Brexit all the way through. So there are certain things where I think passion needs to come through.
Okay, thank you so much for that answer. I know that this is a very important topic for a lot of us. Also, I wanted to ask why do you feel this career is more suitable for you rather than the other ones in veterinary profession? Why do you feel good in public health?
I like it. I enjoy it. I get a lot of reward from it. That's the positive. The negative is that I was never an effective or good surgeon. I was good medically, but not good surgically. Um, and I enjoyed my interactions with clients, but yeah, I think I do have done better in this field than I would have done trying to specialize in a clinical field.
I mean, being a surgeon and suturing and all of this handy stuff is very hard for everyone, I think. So I totally get it. We talked a little bit earlier about the soft skills. So I had two similar questions for you from our members. So, what are your three strongest career attributes useful in your specific field? And also, what, in your opinion, what attributes should a veterinarian have? A good veterinarian.
Okay, no, okay. Gosh, that's a difficult one. Um, I listen well, and I think that's important, particularly if you're dealing with clients, you need to listen. Um, I, I, um, I have the ability to think laterally and globally in terms of thinking outside of the box, as it were. And I think I communicate well. So they're the sort of three strongest attributes I think I have. And what was your second question? Sorry, Zuzanna.
And my second question was, what attributes should a veterinarian have in your opinion, but the good one veterinarian?
Good, yes. Well, it's patience, fortitude, and strength. I think they're important when particularly when you first start off, because it can be a lonely job, it can be a stressful job, and you mustn't put yourself under too much pressure. You need to be realistic as well. Too many of our colleagues are perfectionists, and perfection is not something that flows through the profession very well, I don't believe. We need to be pragmatic about how we're working, but also be um, very engaging with our other colleagues and work as a team so that you're supporting everyone. So I think teamwork is vitally important. And as I've said before, communication skills are essential.
Thank you so much. I agree with you because I know that maybe even if we are alone good at something, when we have a great team, we can do a big things together. So it's really important to have a great people around us in work also. So moving next, I wanted, and I think this will be a hard question for you. What were the biggest challenges in your career?
Gosh, so I've had lots of veterinary challenges. So I've dealt with the foot and mouth outbreaks in the UK. I've dealt with the repercussions from the BSc issue that we've had in the UK. So I've had a lot of those sorts of veterinary challenges. I've dealt with a lot of political challenge in terms of structural challenge. The biggest single challenge is, well, to be honest with you, Zuzanna, it's mental health issues. So it's been a big challenge for me in the last few years, and it's just addressing that, and it's working with friends and colleagues to work your way through those challenges.
I don't even know what to say right now, but I just wanted to say that you are really strong, and I think that speaking loud about the mental health in veterinary medicine is super important. And I know that maybe these days things are better now, uh, because I think that when you were in my age, it looks a little bit different, because I know that mental health is a quite new topic for veterinary medicine. So I just wanted to thank you for that, for this, for sharing with us, because I think this is really important, especially for us young people, to see that it's nothing bad to have problems, because all of this, all of us having something, and mental health is really, really important, and we all should support each other. So thank you for sharing that with us. And now, last but not least, I just wanted I just wanted to ask you for giving us some take-home message. What would you say to those looking for your career?
I would say keep smiling, keep happy, keep focused, and seize every opportunity that comes your way. Um, don't get trapped in anything that you're doing. Just keep looking around. The opportunities will present themselves. Don't panic if you don't immediately see an alternative opportunity. Something will come around the corner, and just keep your mind absolutely open to the possibilities of doing something different. It's amazing how your career takes um, often a very different path from what you might think at the time. So just keep your mind open to those possibilities, and keep looking after your colleagues.
Thank you so much. I think these tips will be very useful for our friends, for our veterinary students, friends, and for those who are looking for plan for the future. So one more time, I wanted to thank you for this interview, because from my side is everything, and I'm very happy that we have a chance to talk a little bit about public health and about your work. So thank you everyone who was listening, who was watching this on YouTube, and see you during the next episode.
And thank you very much, Susanna, for all the work you do, particularly through IVSA, despite all the work that you're doing outside. So well done. Thank you.